Welcome to the Best of Central Florida. I am Justin Clark, and I will never forget the year 2002. I was up in law school in Boston, hanging at the Beantown pub to be exact. A classmate comes over, introduces himself. He said he was from Orlando. I was shocked. I thought Orlando was theme parks, chain restaurants, maybe a water park or two. Who would have thought that now 20 years later, I would have lived here for 15 of them? Who would have thought I would raise my 2 little girls here? Who would have thought I would fall in love with Central Florida? It is a hidden gem. We have great restaurants, professional sports teams, a booming art scene, the Wekiva River, the beaches, and yes, even the theme parks. Michaela Nichols will join me as always from Eustis to Eatonville, Chuliote to Christmas. This is the best of Central Florida. What a great show we have lined up for you today. It is the best dental businesses in Central Florida. Welcome in Michaela Nichols. Now, Michaela, you have beautiful teeth, obviously, right?
Thank you, Justin.
I mean, you don't even have to go to the
hard.
dentist, I imagine, with those teeth,
No, I
right?
go all the time. I think that's a secret.
It's weird, too, because in our dentist, we want someone who we feel is our best friend in some ways, that we want to trust, and we have some great ones lined up today, that's for sure. And also a little bit of an interesting twist. It's not just dentists today. We're talking about people who have to have their teeth replaced, and I love the group we have lined up today.
I do too. I'm excited.
Are you excited?
Justin, you know what? I'm always excited. I'm thrilled today.
The only thing I'm trying to figure out too, and I'm not sure if we're gonna ask them this or not, is why did dentists only work like Monday through Wednesday or Thursday? I've always wanted to be a dentist only so I could have Fridays off.
I mean, because I can.
Is that what it is?
I guess. They're doing a great job, whatever they're doing.
How often do you go? And I don't need you to lie to these people at home. How often do you go?
You know, I go for my teeth cleaning, and then, you know, sometimes a whitening. You gotta go for a couple things, Justin.
So once every 4 years?
Yeah, once every 4 years I go. Probably like a couple times a year, at least.
A couple times, at least. I think we're supposed to go every 6 months. That's what it is, right?
Well, if that's what I'm supposed to do, then guess what? That's what I do.
I'm super fired up for this show, and I know you're gonna love it as well. Literally the best dentist in Central Florida, and it's all just ahead after this quick break.
The Best of Central Florida's Michaela's Choice is sponsored by the Serotonin Centers.
I am here with Eric Casaburi, the founder and CEO of Serotonin Centers. Eric, I have to know, who comes through these doors and becomes a member here?
It's a variety of people. Some people will come in for one outcome or one symptom, and what we'll wind up doing when we do a consult with them, we find out there's a litany of other things that are behind it. So in general, someone might come in and say, hey, I'm here for weight loss or I'm here for Botox, and we might find out that they just need a bunch of other services that we offer.
Wow, so let's talk a little bit about these services that you offer here.
So right now, our primary service is we do hormone replacement therapy, and we tie that to proper nutrition, supplementation, and then we look for outcomes on other things. So areas of performance, cognitive. There's lots of areas where people come in with either complaints or symptoms, and we say, you know, we can fix some of these challenges. Let's put together the proper protocol.
Wow. So is that different for everyone? I assume so.
Yeah, it's truly customized. Everyone, even your vitamins here are customized, but when we sit with one of our practitioners, they're really gonna go through thoroughly with you based on how you're feeling and find out what your needs are. And once we do a needs analysis with you, then we'll put some protocols together, implement them, and then we just follow you along for the journey, and we're there kind of working with you the entire time.
That's incredible and so important to work with you through the journey. So aside from like hormones and everything of that nature, what else do you have here?
So we also have IV therapy. So people come in often and they're either dehydrated or they're not feeling well or their immunity's down, and we have all kinds of packages for those types of symptoms. We also have people that come in here and they want to get some facial stuff done, some aesthetic stuff, things with microneedling. We have Botox, Juvenile, all of the great products you hear about and everyone on Instagram's using. We have all of them here. And of course, we also do a really cool thing with exercise and nutrition. We put together some really amazing, again, practices and principles. We want you to follow these things, but we're going to give them to you so you serve them up and you can just implement them right away be on the path.
Awesome. Well, Eric, thank you so much for your time. And Serotonin Centers, check them out, www.serotonincenters.com. I don't know about you, but when I first look at someone, I automatically look at their smile. So Michaela's choice today is Highland Lakes Dental. I am joined by Dr. Ishbel Nieves. Thank you so much for being on the show today.
Thank you for having me.
So when I first walk into your office, obviously it's so beautiful, but when someone first walks in for the first time, what picture do you want to paint for them?
I want everybody to feel like family, like they just went into their family's living room and they're there just to have like a nice time. Like going to the dentist is a little bit of a frightening situation.
Yeah.
So we want to make it so that people feel as comfortable as possible.
I love that you said that because let's be honest, I mean, if someone's like up in your mouth, I mean, it can be a little bit uncomfortable. So how do you really instill that kind of like family atmosphere for them?
Well, just the staff feels like they're my family. So I think with that, we treat each other like family. So I think with that, we start building a rapport with the patient and having them feel comfortable. Before COVID, we used to have coffee in the waiting room and all that. Now we'll see what happens if we can make that make a comeback with that. But we would always try to make them feel as comfortable as possible. Just treating them properly and giving them a nice welcome.
Definitely. So you mentioned coffee. So coffee, that's one of the main things that like can stain, right?
Right.
God knows I have way too much coffee.
Right. Along with Coke products, red wine.
Hey. I'm sorry.
So how do you combat that? I mean, can I come into your office for like just solely a teeth whitening?
You can. We would obviously like to make sure that everything, like all your teeth are in good shape, that you don't have cavities and nothing is happening, because with whitening, if you have a whole bunch of cavities, then those can get worse. You can have a lot of sensitivity and toothaches. So we would definitely like to make sure that all your teeth are addressed and all your dental concerns are addressed before going into whitening.
And something you mentioned earlier, I mean, you're talking about family and you've had different generations. How important is oral hygiene at various stages throughout your life?
Oh, it's very important. We have to think about the fact that we were not meant to lose our teeth. So we definitely want to keep our teeth for as long as possible throughout our lives. I mean, we still have to eat when we're 80. So definitely that's very important.
So aside from like the typical cleaning, you come in once every 6 months?
We do recommend once every 6 months, as long as the patient is healthy and they're able to take care of their teeth. There are some patients that would come in every 3 to 4 months, depending on their needs.
Wow. So if someone comes in, for a teeth cleaning, what else do you offer aside from that and whitening?
Okay, we are a general dentist practice, so we offer restorations, crowns and bridges, dentures, partial dentures. That's a big portion of our practice, just because of the location. We as well offer implants. We do have a periodontist on staff that addresses periodontal disease, gum disease, and basically the supporting structures of the teeth as well. And she basically does our surgeries, our implants, most of our extractions. And then we do restore implants, either a single tooth or a denture supported. An implant supported denture.
For some reason, when I think about a dentist, you want to feel comfortable. You want your dentist to feel like part of the family. And I know you treat your patients that way too, but it's way more than that at Highland Lakes. You guys really are a family, generations of.
Right. The office, like I've had multiple members of my family work at the practice. My cousins, my husband, my mom have worked at the practice. So we really do feel like a family. And then patients as well, when they come in, we have a full schedule, but I always like to give them time. Everybody. I sometimes sing to them whenever
Go ahead, fire away.
Yeah,
We have
please. I
plenty
mean,
of
if you
time.
want to go for it.
Oh my gosh, no.
Michaela, you want to
Oh, no.
No,
I won't expose her to that.
No,
She
no,
was
no.
singing during the break, honestly, if you want the honest truth.
No, I'll sing to you at the office.
Okay, all right, we'll be there. I'll come.
I love that. So another thing you kind of mentioned earlier is just maintenance, right? You know, between the teeth cleaning and even just like the maintenance of crowns. How important is that for like a typical patient?
Patients have to understand that you can get a cavity under a crown. Your crowns can break. You can have infection under your crown. So it's very important that you or patients take care of their new appliances, prostheses, crowns, and bridges. It's a big investment. So you definitely want to make it last. So maintenance at home care is very important. Flossing, I know a lot of people don't
flossing.
floss real good or don't floss at all. That's very important because the toothbrush sometimes doesn't get everything.
And so rumor has it you're expanding.
Yes, like we are in the initial talks right now. It may or may not happen. We're still looking for a place to possibly open a practice just because we want to serve more people.
Well, makes sense. Well, doctor, thank you so much for your time. Highland Lakes Dental, please go check them out, and we will be right back with Justin's Choice after this short break.
The Best of Central Florida's People's Choice is sponsored by Dr. Gergen.
I'm Dr. Johnny Gergen. I'm a board-certified dermatologist and a Mohs surgeon. We have 2 office locations in Leesburg and the Villages. We specialize in, obviously, dermatology and Mohs surgery. We do both in our locations, which means you don't have to be going from one location to another to get the procedures done. Our main focus in our practice is to be able to detect skin cancers early. In order to be able to detect them early, our providers focus on very detailed skin exams. We pay attention to every detail, we take our time with our patients, we look at things over and over again, we answer all questions and make sure it's a thorough examination because early detection is the key for skin cancers. Skin cancer really starts to pick up 30s and older, and at that point we recommend twice-a-year checkups, and when they're detected early, it's a very simple fix. Simple excision. This way you avoid any chemotherapy, radiation, or any difficult procedures. We always recommend looking at your own skin, looking to see if you have any dark moles that are changing or any red spots or skin color spots that are not healing. Usually most skin cancers do not have any symptoms. So you really don't know they're there. They silently grow and it's very difficult to detect them unless you're actually looking at them yourself. So every so often you can look at your skin, see if there's anything different, anything changing, anything that's dark. And when you see that, you don't really need a referral to come see us. You can call directly to a dermatology office and have your skin looked at. If you would like to contact us, our phone number for both the Leesburg and Villages office is 352-435-7695.
Finally, it's time for my favorite part of the show. It's Justin's Choice. Her least favorite, I guess, right?
No, it's
Michaela?
definitely one of my favorites.
The winner this week for Best Dental Implant goes to our very good friends at D5 Teeth. Happy to be joined by Dr. Miranda. Doc, how are you, sir?
Thanks for having me.
D5 is really changing the game, let's say. It's cutting-edge technology that you use to really help people who are having teeth problems replace their teeth, and you do it quickly. Tell me about it.
Absolutely, it really is cutting-edge stuff. Basically, this is for people that have terminal dentition, that need a full mouth reconstruction. So what we do is we extract the teeth, we place the implants, and a turnaround time of only 1 week, we get you your final fixed zirconia permanent teeth with only a 1 week turnaround
1
time.
week.
1 week.
Absolutely.
Compared to the previous ways we used to do it in other dental implant centers, you wear temporary for many months, anywhere from 3, 4, 6 months, and these temporaries don't look good, they can break, they are not very aesthetic at all. And then after that, it's multiple visits, multiple appointments to finally do your final. So we're taking a 6-month period of time, that's what we used to take, and we're condensing it into 1 week.
And you know, I think a lot of people are going through a decision. They say, okay, I know I have a lot of things going on in my teeth, a lot of things bad, and maybe they have a dentist who says, well, I think we can maybe fix it up, but it's not a bad idea to have a consultation with you to see if it's easier to just do full-blown dental implant. Let's say I want to come see you. What does a consultation cost?
It's a free consultation.
Free consultation. So I can come in. So if I have my family dentist telling me one thing, it's not going to hurt to come in and see you.
Absolutely not.
And because sometimes it's just better to almost say bite the proverbial bullet and just fix everything at once, as opposed to keep really just every day being at the dentist trying to fix one thing at a time.
Absolutely. We have patients usually that are retired, that have been decades at the dentist.
Right.
It's fillings, it's crowns, everything, you name it, and they've gotten tired, and the teeth still are breaking down, it's still not working for them, and they want one final solution that's quick, easy, and simple.
And one of the things that I noticed about you guys, which I think is fantastic, yes, of course it costs a little bit of money, it's very reasonably priced, believe it or not, but I know a lot of people that have been there and they paid really nothing down and they can get on a payment plan. You offer financing.
Yes, absolutely. We do offer several financing options. One other thing I want to add, because the visits are so condensed within the week and it's not a drawn out 6-month project, the costs are substantially lower than other dental implant centers.
You know, it's one of those things too where if you start adding up, okay, I'm going to do this crown here, I'm going to do this root canal there, it's actually less expensive than piecemealing your mouth, which, by the way, the teeth are fairly important, I think, to your body.
Of course, yeah, absolutely. Sometimes it's less expensive than just doing a full arch over implants and going piece by piece, tooth by tooth, trying to fix things.
How do I go through that decision-making process? I know that I have some things going on here. I know that it's not going great for me in my mouth. I'm trying to decide, do I do the implants or not? How does that decision-making process go? And take me through that.
So you come into the office, make an appointment for a free consultation. During that consultation, I'm going to take a CT scan, and I'll sit with you, and we'll go tooth by tooth by tooth, and we'll look at generally your full mouth, and we come up with a decision if we should do the D5 protocol or not. There are people that will do just one upper, and then we'll save some teeth on the lower, and then there are people that will do the full mouth uppers and lowers. And that decision we make at the day of the consultation.
You know, one of the things that I've noticed, and unfortunately I think Florida has a bit of a drug problem at times. I've seen some clients of mine at my firm who had a drug problem back in the day, and they've gotten better. But one thing that has not gotten better is their teeth. Unfortunately, It's a big problem here. Do you see that, and how do you take care of it?
Yes, unfortunately, I've been seeing a lot of younger patients, unfortunately, that had substance abuse problems. And unfortunately, we had to take the teeth out. But the D5 protocol would give them fixed, brand new teeth in 1 week, and their life is reestablished.
Yeah, you're changing their lives.
Changing their lives, exactly.
I mean, they've already recovered from one of the biggest, worst diseases you could have, and yet they still had the scars from it, which was their mouth. And now in 1 week, you're literally changing their lives. You're removing those scars. What is the recovery process like?
So it is a 1-day surgery process. The following day and the second day, you'll be a little bit swollen, a little bit of discomfort, but we manage that with medications, okay? You will be on a soft diet for some time, but it's really not that bad at all.
This used to be a lot worse. I think a lot of ways about a hip replacement. People who get hip replacements now, it's actually not as bad as it used to be.
Exactly.
Same thing with what you're doing. Explain the differences in how it used to be versus you at D5 with your cutting edge technology.
Exactly. So way back when you took teeth out, you put implants in, you'd wear a removable denture, okay? Just comes in and out, horrible. It evolved a little bit over time to give us fixed teeth on the day of the surgery, but that's the older fashioned way where you wear the temporary for about from 3 to 6 months. And those, like I said, those temporaries break, they don't look good, they're horrible.
Right.
Being able to give you the D5 in 1 week, all those problems are eliminated. And in 1 week, you get a beautiful smile.
Unbelievable. Yeah. I'm so impressed with what you guys are doing over there. Explain the difference, because I didn't really know until I got to know you a little bit better. Dentures versus implants. What's the difference?
Well, a denture usually refers to a removable appliance or removable prosthetic that comes in your mouth and comes in and out. Okay, the chewing capacity is nowhere near what the dental implants can give you. They're fixed teeth that feel like your own teeth and they look like your own teeth. With the dentures, traditionally you had to wear the denture adhesive. Things can slip out of the mouth, and it's just not, for quality of life, that is no longer considered the standard for good quality of life. Basically.
Unbelievable.
Yeah.
Dr. Miranda, what a pleasure, buddy. Yeah, congratulations on what you're doing over
Thank
there.
you so
I
much.
think you're really changing lives and certainly changing them for the better. I'm really impressed with what you're doing. By the way, if you have mouth issues, there's no reason to not get a second opinion. Your dentist might be telling you one thing, probably a great person, but there's nothing wrong with checking out a second opinion. A free consultation over at D5. Dr. Miranda will take very, very good care of you. I can guarantee you that.
Yeah.
Dr. Miranda, what a pleasure. Thank you so much, buddy.
Thank you
I
very
mean,
much.
this guy is something else, is he not? Here's what we're gonna do. One last quick break. When we come back, we will wrap up the show. We'll see you in just one moment. Quite a show today. Very special thanks to Highland Lakes Dental and D5. You guys were awesome. Please go check them out, by the way. Michaela, that was fantastic. Are you ready to lay off the sweet tarts now, or now you feel like you have connections and you can eat all the sweet tarts
I mean,
you
I
want?
feel like I have connections. I feel like I don't have to give up candy.
So you're gonna stay on the candy?
Always.
The candy diet? That's
Always.
the one?
I mean, that's just what I do.
Yeah, it was an awesome show. Now, next week is pretty special as well. Date night. Tell me about that. What does that mean, date night?
I'm excited. I mean, there's so many different dates here in Central Florida to just, go with your significant other or even your best friend. Like, why not, right? Best friend dates are great.
Great job today, everybody. And to our CBS crew here at WKMG, you guys are awesome. You're like family to me. Even Joe. I love Joe, too. You?
Joe, you're
Joe's
phenomenal.
fantastic today. To our entire crew here, thank you guys so much. Great show. Thank you for putting it together. Most importantly, thank you for joining us here every single Sunday. Can I ask you one favor? Can you hit record series now? And we'll see you back here next week for Best of Central Florida.
Want to know where the best breweries are? How about the best pizza and the best beaches? Find out each week as we explore a new best of. It's the Best of Central Florida with Justin Clark and Michaela Nichols every Sunday at noon right here on WKMG TV 6.